Welcome to PAMED Talks, a podcast brought to you by the Pennsylvania Medical Society. I'm Dana Lombardo, and I'm one of the outreach specialists here at PAMED. If you've been following along with our resident wrap-up newsletter, you're going to want to stick around because today we're taking that content to a whole new format. This is the first episode of our resident and fellow series, real conversations on what it means to be a physician in training for residents and fellows who are living it, and for all physicians who remember what that chapter felt like. We're joined today by Dr. Joshua Wyner, Chair of PAMED's Residents and Fellows section. As a Charleston, West Virginia native, Dr. Wyner received his undergrad degree in biology from the Miami University in Ohio. He returned to Huntington, West Virginia for med school, graduating from Marshall University. Currently, you can find him at Allegheny Health Network in Pittsburgh as an internal medicine PGY2. Today, we're getting into what residency looks like from the inside and how younger physicians can get more involved with PA Med and physician advocacy. Dr. Weiner, we're really glad you're here. Welcome.
Yeah, thank you so much for having me. I really appreciate it. I'm excited to get the chance to speak on this.
Absolutely. So now that we have a little bit of information on the where you came from, we'd love to
Yeah,
learn some more about your personal journey into medicine and the why.
yeah.
So, when did you decide to pursue medicine, and was it a gradual calling, or was there a specific experience or moment that made it click?
Yeah, so I think in high school, I was definitely very science driven. I was somebody who, I mean, I would like to think I tried at all subjects, but I remember biology, chemistry, those came easier to me. And so when it came time to pick majors for undergrad, I naturally chose biology. And I was thinking med school at the time, although I will admit I don't think I really knew too much of what I was getting into yet as an 18-year-old starting freshman year of college. And so, I went through the motions kind of until probably around junior year. And around the time of junior year, the classes started to get a little harder, more difficult. Specifically, I'm thinking of, biochemistry one and two and physics, algebra, and calculus based. And, I really had to commit at that point in time that I wanted to put in the work and go to medical school. And I remember I had an experience that kind of solidified the decision to go to medical school. I was working in a pediatric hematology oncology clinic in Charleston, West Virginia, where I grew up over the summer. And I saw a young girl get diagnosed with an osteosarcoma for the first time. And osteosarcoma is a very serious diagnosis. I remember being in the room and just the weight and the gravity of the situation was something I had never felt before. The parents were crying. The attending physician that was delivering the news was holding back tears. I was holding back tears. And so I came back after that junior year and decided that I think that was really a space where I could make a difference, and I decided to go ahead and put in the work and double down on deciding to go to medical school after that.
Wonderful. When
Yeah.
you look at residents that are coming up behind you, do you think that they're drawn to medicine for a similar reason, that being either like an experience of themselves or something that they observed, or does that
Yeah.
motivation feel different right now?
Yeah, I think it's so difficult right now, just with my generation of residents and fellows and future physicians, and the ones even younger. And I think most of that is due to COVID. The reason it's difficult to kind of quantify or characterize, how what the motivation is, how much motivation there is. I think pre-COVID, there was a little bit of a different mentality where it wasn't as glamorized, it wasn't as publicized, there wasn't a lot in the news. And then COVID, you see on the news, like look at epicenters of the disease, like New York City. I mean, people were very, very sick at the time, and that really fired some high school and college students up. And I think the application rates to medical school like tripled within COVID. So I think the motivation is for the next generation is largely the same. It's just, I mean, it's so difficult because nowadays, I mean, the experiences that we had within the last couple of years are so so vastly different from even what residents and fellows a couple years ahead of me had to deal with. And I can't even imagine the people who were training in COVID as well. But largely, I would probably think it's the same.
Yeah, that's a great point. The world definitely looks different than it did several
Yeah,
years ago.
totally different. Yeah.
And so, being as this is such a long journey through schooling and through your
hmm
residency, did you have any roadblocks that made you second guess pursuing medicine? And did you
Yeah.
observe any stumbling points that your peers ran into as well?
Yeah, I mean, if I'm being completely honest, I still have stumbling blocks every
Hmm.
day. Just, sometimes waking up and going into work can be difficult. The first and foremost I think of earliest on in my journey to medical school was when the classes got difficult and I really had to start investing more time in studying and, asking myself, was this worth it? And I eventually decided that this is what I want to do for the rest of my life. And I want to make a difference and treat patients and see physical healing was the reason I ultimately decided to go to medical school. But it is completely normal for residents and fellows and medical students and undergraduates to hit roadblocks in their career. It can be grades, it can be personal family events that happen that are completely out of our control.
Hmm.
I mean, even you'll hear, I'm sure there are stories out there of attending physicians running into roadblocks in their career or just simply waking up and not feeling like going into work and being able to answer the call to treat their patients, but they do it anyway. So that is a completely normal thing. I think that, a lot of fields of medicine are high demand, especially like we were talking about in the post-COVID era. So I think it is completely normal to hit roadblocks in a career for somebody deciding to go to medical school.
Yeah, absolutely. And you brought up an interesting point of how,
hmm
just medicine in general was glamorized to a certain extent during
hmm
COVID. And, we watch all these shows on television. And how did you, how did your expectations of residency compare to the reality once you really got in there?
Yeah, I think residency was largely what I anticipated it to be. Mostly, I think, most medical students, when they go from fourth year med student to intern, there is some expectation there that I think is realistic, and a lot of it revolves around the amount of time that they have. Just simply
Mhm.
put, I mean, even with medical school, there are restrictions on the amount of time you have because of studying, but with residency, it goes down even more just because there's more hours. The emotional demand is a little bit more, especially
Mhm.
if you're caring for patients actively on a floor, if you have a service. So I think that the expectation on my part personally was realistic. One thing that took me by surprise was how often I feel like I'm batting out of my comfort zone.
Mm.
Like we said earlier, I'm an internal medicine resident, and a lot of internal medicine can be very difficult situations. I mean, out of internal medicine, you can go into oncology, you can go into cardiology, ICU, pulmonology, critical care. And so, there's a lot of situations where I find myself, I'm a second year, I'm about halfway through. In the last year and a half, I found myself giving people advice that have 30, 40, 50 years of life experience on me. And I'm talking to them about their significant other, who they've been married to for 50 plus years. And they look at me and they say, Doc, what would you do? The weight of that is not benign, I think, to be
Yeah.
28 years old and be giving somebody who's 65 advice about their significant other. And I'm forthright with all my patients, and I say, listen, I'm not God. I can't predict the future, but we're here with you every step of the way, and I'm presenting the objective data that we have at the current time to be able to help you make a decision. If you need help, then we can step in as a treatment team. But that was something that took me by surprise. The first month of intern year, I was on ICU and dealing with goals of care a lot as a first week intern. I've never had problems sleeping before. I
Mhm.
usually am the type of person that head hits the pillow and fall asleep easily and stay asleep through the course of the night. but I was having a hard time going to sleep. I remember when I realized the weight of the the position that I had accepted. It can be very stressful, but you gradually learn to get used to it.
Yeah, absolutely. Sometimes being out of your comfort zone is where you grow, but it's not always comfortable,
A
obviously.
100%.
Do you think that there's anything that the programs could do to support you guys in that area? Any like additional training or things you wish you would have had known of prior
Yeah.
to being in those conversations?
Yeah, I think unfortunately, it's trial by fire. I think, especially depending on the specialty. I have friends in all sorts of specialties. I'm an internal medicine resident, but I have friends in neurosurgery, orthopedics, anesthesia, general surgery. And the consensus is the same. Largely, all of these people are having these conversations, with their patients as well. And, we're all coming out of medical school somewhere between the ages of 25 to 35 and dealing and treating patients and their spouses that have been married for longer than we've been alive. I think that unfortunately, you kind of just have to weather the storm. I know a lot of programs try to show support and remind their residents and encourage them that they're doing the right thing. They were put there for a reason. I know my program does. When we do something difficult, if we tell a chief or an associate program director, the program director, there's a pat on the back, that you're doing the right thing, and this is not factually just not an easy job sometimes. And it is unfortunately the nature of the job that you might take some emotional baggage home with you, and that is okay because we're human and we should be able to feel things. I think it's of greater concern if a program tells you not to feel the emotion, which I have not heard of any program doing. I think that reminding us of our humanity is a really good thing that programs do in residency and fellowship.
Very well. And kind of pivoting towards yourself and some of the more
Mhm.
established physicians that you work with on
Mhm.
a day-to-day basis, have you ever run into any communication struggles? And if so, how do you close that gap?
Yeah, I think to be honest, the number one communication struggle I can think of, and I'm trying not to just speak for internal medicine programs, I'm trying to speak for residents and fellows in general, is between attendings and trainees is the assumption that we're comfortable doing something we've never done before, and I think that sometimes trainees are too scared to actually before the attending walks away, grab them and say, hey, no, wait, can you actually walk me through this?
Mhm.
Or that if there's an order in the chart that needs placed, or like a certain consultant that needs talked to, and there's a particular way of going about it, then it would be beneficial to be shown that the first time. I'm a big proponent of see one, do one, teach one, and I think
Mhm.
that cements skills for down the road. But I think a lot of academic medicine nowadays, unfortunately, carries the weight of assumption, meaning that the generation before it feels comfortable trusting the next generation with something that they're not sure whether or not they know how to do. And I think that if the communication were to be prioritized and being able to just raise your hand and say, listen, I need shown how to do this, then I think that medical training would benefit tremendously. And that's not a blanket statement on all training programs at all, but, sometimes I've heard from other specialties and, it has come up in my own specialty that, oh, maybe I don't feel comfortable talking to this crit care physician yet about, this early on in intern year about, why this patient needs to come to the ICU, or maybe I could use a little bit more guidance on, placing a central venous catheter in a patient's internal jugular vein. Maybe slow me down, show me the steps first before I approach, but really just trying to be forthright with the communication and what level we're all at.
In that same vein, I'm sure we have
Mhm.
some medical students that are listening. If
Yeah.
you could share a little pebble of information, maybe something you wish that you had learned on day one from someone else, what would you say?
Yeah. I think in residency, it's very important to take it day by day. I think that I don't think I know. There will be really bad days and there will be really good days. And training is long, regardless of what you want to do, even the shortest programs being 3 years. I mean, 3 years is a huge investment.
Mhm.
So you can't base your whole training off of one day. If you have a bad day, find a friend, a co-resident or a co-fellow to talk to, find a senior, that and just say, hey, I'm really struggling with this and really try not to make knee-jerk reactions or, treat people a certain way because something happened, because objectively there will be something that comes along that you remember for the rest of your life that is just going to be very difficult and there's no way of getting around it. And at the same time, I think that the senior residents should offer, support for the new interns coming in and, just periodically checking in on them, making sure that, they're okay. I think that
Yeah.
it goes for new interns, it goes for senior residents and everybody, just not to base the whole span of medical training over the course of 1 or 2 days, And then the second thing I would say is the kind of what we touched on earlier with batting outside your comfort zone. There are going to be a lot of things that you're instructed to do, or maybe kind of given some degree of independence that you're not quite comfortable with yet. And as long as patient safety is a priority, then sometimes there has to be trial by fire, and having the conversation with the patient's medical power of attorney, or you know putting in the order that you haven't necessarily put in before, and communicating with the nurse to make sure you're doing the right thing. So there is going to be some degree of self-sufficiency, but it's very uncomfortable at first.
Understandable.
Yeah.
So that kind of brings us around to another topic I wanted to touch on. I know it's something that I touch on a lot when I'm out in the field doing outreach calls, and that
Mhm.
would be physician burnout.
Mhm.
And I wanted to see, in your opinion, do you think the general public really understands the toll that burnout takes on physicians, or is there a disconnect between how doctors are perceived and how they're actually feeling?
Yeah, I think that nowadays they're kind of, with what we were talking about, how medicine is publicized nowadays, especially in the post-COVID era. I think that a lot of the public does understand the pressure on physicians to be able to, because sometimes it feels like a performance. I mean,
Mhm.
you want to do well for your patients. Residents and fellows want to impress their attendings. They want to learn as much as they can. And I mean, it can take a toll if you don't limit it and invest in yourself. And I think that, largely patients do understand the implications of everything it takes to become a physician. It's a high responsibility field that, that doesn't negate that fact that when you take the oath to do no harm, you are accepting a major responsibility. But we're human too, I mean, there's no getting around it. You're, supposed to feel uh, emotion and difficult things that can precipitate burnout. I think that a lot of TV shows nowadays kind of touch on it. The one that most significantly is The Pit. I'm thinking of, now Dr. Rabinovich is taking this sabbatical in The Pit, and the previous season he had a mentor of his that passed away in the ED. I think that's just one example, but it is becoming more prevalent for people, I think, to become aware because of the transparency. We have access to more information nowadays with AI, and I mean, it's so easy to look things up now. But I have had patients ask me before how I'm doing, and I have to say, oh well, that's not why you're here. We're here to talk about your diabetes, your blood pressure, or whatever. But I appreciate the sentiment. So I would say it is probably known about somewhat to a degree.
Yeah. Yeah, that humanity gets to go both ways.
Yeah, yeah,
And with that in mind too, what does self-care look like for you, and how do you set boundaries for some of that
yeah.
emotional work?
Yeah, I think for me right now in residency, since I've started, I think practically speaking, I got much more into moving my body than I worked out and did, I played soccer and frisbee in medical school. But I wasn't, I kind of treated it as like a study break. Whereas now it does feel like true wellness to me. And
Mm.
I tell my patients this that I see in primary care clinic and the patients I see in the hospital, I'm getting ready to discharge. There's no secret sauce. It can just be 30 minutes a day, just to get out and move your body. Ideally, the weather's nice in Pittsburgh, Pennsylvania, not all the time. It can be kind of gray and rainy here. But just to do something active and actually, physically move. On the flip side of that, I also enjoy periodically just resting on the couch, watching. I love watching Premier League soccer on Saturday mornings if
Yeah.
I have a weekend off. And then, I've made a really good group of medical friends here with, built-in friends basically with my residency programs and going out and doing stuff and just making time to make sure that, I have, access to be able to talk to people if I need to talk to people, and relax when I need to, and physically move my body are the main things. I see a lot of residents, the talk and fellows now, the talk is kind of, you know, I did my shift in the ICU, I did my shift in the cardiac ICU, or, in the ER or wherever people are. And they say, I just came home and went straight to bed because I was so tired. And don't get me wrong, there are plenty of those days too. If I'm being completely honest, my life is nowhere near perfect. And I don't think, I think if anybody told you that they maintain a perfect workout schedule and social schedule and, et cetera, in residency and fellowship, let alone people who have kids, and significant others and partners, then they would be lying. I think that it's very easy to finish a long shift or have something bad at the hospital happen and just come home and go, lay straight on the couch, turn on the TV and close your eyes. That is also, that can be wellness for people too.
The foundation of PAMED offers peer assistance monitoring programs to physicians, pharmacists, nurses, support staff who have concerns relating to substance use disorders, mental health, behavioral concerns, things of that nature. It's something that I make sure to mention when I'm out in the field doing outreach. It's a sensitive topic, and people don't always
Mhm.
have the courage to ask when there's someone in front of them. So I like to make sure they have the information that they need. Um, is asking for help of any kind still stigmatized in medicine, or is that culture shifting?
No, I do think the culture is changing. I think, we all know the stereotype of years ago with the, residency and fellowship programs keeping the surgeons and the proceduralists for hours and hours on end and not offering them a break and, kind of demanding no emotional attachment to situations and just work, 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 work. But I think nowadays the landscape is completely different. I know my program and several of my friends' programs offer and incentivize their residents and fellows to sign up for therapy platforms, online. If it's online, great, like BetterHelp, but nothing really beats the fact that the people who know you in the residency program check up on you. And I can
Oh,
tell, I think there's a huge push towards wellness nowadays. And it's even brought up in interviews, I think, when medical students are rotating or are interviewing for residency, that the program directors want the applicants to see that wellness is a priority, and so they sponsor activities and dinners and breweries and things like that. But also too, I think that programs who have program directors, associate program directors, coordinators, attendings that just check on you periodically, which I can say for my program is invaluable. And I think that, those things all lead to a drastic change in landscape in terms of asking for help with mental health than previous.
it's really great learning that you have such a good community behind you in that
Mhm.
program. I love that.
Yeah. Yeah.
So being able to improve a lot of these things that we're talking about, just the
Mhm.
residency experience, burnout, it comes down to who's advocating for physicians, and that kind of takes us over to PA Med.
Yeah.
So before getting involved with us, what did you actually know about PA Med, and like was it on your radar in med school, or did you come to it after later in your
Yeah,
career?
so I didn't know much about PA Med. I had to sign up for the continuing education markers when I came to Pennsylvania, and so I had an account, and I would get the emails, and I would see kind of things that were going on intern year, and I saw there was a lot happening. I didn't know what House of Delegates was my intern year when I first moved to Pennsylvania. I kind of read about it, and I was like, "Whoa, this is really cool. I could actually have a chance to make my voice heard outside of the wards in the hospital, and I kind of sought the platform that Pennsylvania Medical Society gives its, members. And so I initially signed up or applied for a member at large position. And I kind of actively participated a lot the first year, and that wound up in writing a resolution to the House of Delegates in 2025, talking about discussing immigration in our country and the landscape behind the variability in the recent changes in immigration in the United States. Is a lot of physicians and trainees in Pennsylvania are international medical graduates, and we rely on a vast population of people from all over the world to serve our patients in Pennsylvania. And so that was the kind of the first thing that I was able to take a stand on and speak on, writing a resolution to the House of Delegates. And the leadership, the governing council from last year, kind of approached me about tentatively becoming chair, then running for chair the next year. And I said, whoa, I don't think I really know as much as I need to be able. Barely felt like I knew enough to become a member at large, but they kind of just reminded me that actively showing up and having a voice and trying to be heard is really the most important thing. And so I ended up running for it and got chair. And I'm still we've talked about this numerous times. I'm still in a position where I'm learning every day. And I think if you're not learning, then you're doing something wrong, and you should find some way to change your mindset and learn something new. But it's really been great the last year and a half, and I've taken away a lot and gotten some invaluable experiences as a result of being involved with Pennsylvania Medical Society.
That's awesome. Yeah, we're always welcoming new people to all of the special sections meetings.
Mhm.
And for anyone who isn't familiar, can you give us a little bit of a summary of what the residents and fellow section is, which we usually call RFS, and what you
RFS.
envision that being like in the future?
Yeah, so the purpose of RFS is to boost involvement of residents and fellows and bring them into the medical society and let them know that their voice can be heard, like I said, and act as a speaking body for a large set of physicians in the state of Pennsylvania. And I, really kind of what I envision over the course of the next year during my tenure as chair of RFS is just to boost involvement of medical trainees, residents, and fellows. And I think that once we have more involvement between residency and fellowship programs, I think that there are a lot of important things that we could address. And we obviously have things going on behind the scenes. There's always ideas being brainstormed for resolutions to write for House of Delegates, or occasionally people are reaching out to congressmen and women about issues in the environment, drug costs. I've heard of people reaching out to their local representative about and trying to reduce the cost of important medications, or seeing what the current temperature is on being able to put legislation in front of the House of Representatives and the Senate to be able to do so. But I think the most important thing is just giving residents and fellows a place to belong, and that can look like in-person networking, that can look like joining the monthly section Zoom meeting. I mean, there's numerous ways to get involved. It really just takes signing up and getting on your first meeting, even if you feel like you don't know a lot.
For someone who's been on the fence about maybe getting involved with us over at RFS, can you give them a little bit of an idea of what our meetings look like and just explain the culture there?
Yeah, absolutely. So the meetings are very low key. There's absolutely no, formality, or, there's nothing. There's an agenda, but there's no pressure. It's a very low stakes situation. Typically, we'll run down any current RFS agenda, or any RFS talking points things that we're actively working on that we need to discuss. As the year gets closer to September, October, we do start to discuss resolutions that we're going to put forward as a section at House of Delegates. There will be preliminary meetings to discuss, what kind of revamp the resolutions will require prior to being submitted to House of Delegates. And so, there's really it's real. I tell people who ask me or they're thinking about getting involved with Pennsylvania Medical Society, it's really what you make of it. When you're involved with the section, you do have the privileges of, reaching out to yourself, Dana, and, asking, how can I help better myself in pushing forward this agenda, or asking, if we want to get involved with PAMPAC or something like that. There are resources to be able to do that. And so I think there's just so many exciting opportunities through the course of the academic year.
Yeah, I always tell people too, you don't even have to have your camera on. We just want you to attend to kind
Yeah,
of get in the
just,
loop of
yeah,
what's going on.
absolutely.
And for anyone listening, if you do want to get involved, the best place to go to is our landing page. So if you go to the PAMED website and go to pamedsoc.org/RFS, that's where you can register for all of our meetings. Typically, our section meetings are held the third Wednesday of the month, and our next meeting is on April 15th. That landing page is going to be your go-to spot for anything that you need in the future as well. So go ahead and bookmark it, check it regularly. That's the place to find all the information. And before we do move on, there are a couple of other important things for RFS members to know about right now. We do have nominations open for two key positions. So the RFS trustee to the Board of Trustees and the AMA's RFS slotted alternate delegate. So if you've ever thought about stepping into a leadership role, these are great opportunities. The deadline to submit your nominations is April 10th, and you can find everything that you need on that landing page. Also, the special election for both positions will take place at the April 15th RFS meeting. For the Board of Trustees, there's one more additional step where the section's endorsed candidate will then go to the board for full approval at their May board meeting, but we will do that endorsement that day. So, Dr. Wyner, before I let you go, is there anything else on your mind or anything we didn't touch on that you'd like to make sure all of our RFS members know?
Yeah, I just keep coming around would be, the my last tidbit of advice. As somebody who was new to Pennsylvania, living here and new to Pittsburgh specifically, I didn't know much about Pennsylvania Medical Society, but it's such a welcoming community, and there's a lot of possibilities for networking and mentorship. And I have gained some invaluable relationships from being a part of Pennsylvania Medical Society, namely the people that were on the governing council with me when I was a member at large, and really took me under the wing and showed me things like how to write a resolution and how to, just basically make my voice heard beyond the walls of the hospital. I think that those are things I will take with me into my career as a physician. And, I may never see the likes of being in a government position down the road, but it's made me a better person and a better human as a result of being involved with Pennsylvania Medical Society. So it's something that I am extremely grateful for.
Thank you so much, Dr. Weiner. I'm so grateful for you to
Yeah.
joined us tonight and carved out the time to do this podcast. And we're really lucky to have you leading RFS
Yeah.
this year.
Thank you so
Uh,
much. It was great speaking with you guys.
Awesome. So before we wrap up, everything we mentioned today, the RFS registration for meeting dates, nomination details, it's all going to be linked in the description box and show notes. So make sure you check that out. And for our residents, fellows, med students, and early career physicians, mark your calendars for the quarterly combined section meeting on May 26th. We're going to have Dr. Marilyn Heine, who is a PAMED past president and an AMA Board of Trustees member, delivering an Advocacy Day presentation. You won't want to miss it. And all members of all of those sections are welcome to register. You can do that at pamedsoc.org/events. That's all for today. Thanks for listening, and we'll see you next time.